Crisis Communication by Armida, Janelle, Caroline, and Teresa. We'll first discuss our how might we, sources, solutions, recommendations, and lastly our strengths and challenges. Let's begin with our how might we question. How might we improve the quality of care provided by the physicians and staff members in order to attract donors, voter support, and privately insured patient intake? We chose this question once we assessed the Yelp reviews of the Doctors Medical Center. As you can see in this chart, a majority of people gave this hospital a 1-star rating. Some claimed they were verbally abused by the ER nurses, sexually assaulted by a security guard, and some even felt that racial remarks were made by the physicians. Many claimed that the staff were not attentive to their needs. So we think that if we improve the quality of care provided by the hospital, its perception among the community will likely improve. An improvement in the public's perception will attract more donors and increase voter support. Therefore, there will be more financial help. In addition, its higher quality of care will attract more privately insured patients. This can help improve the hospital's payer mix. Next, we will discuss our sources. We had a phone interview with Tamara Marr, who is a caseworker at the Suitcase Clinic, which provides services to the homeless, women, and youth without much funding. She said that in order to make their program sustainable, their staff members must be passionate about their work. They must also spend time learning about the issues that their patients are facing. We then emailed the social media manager at California Healthcare Foundation, and she told us that it's important for the DMC to research its target audience. For example, it could hire a PR firm to conduct focus groups with voters to learn why they voted no on the measure. She also recommended that the hospital should prove to its residents that they are there to serve them, regardless of their socioeconomic status, race, or gender, in order to improve their image. The hospital should conduct community surveys to assess what the community wants. We also spoke to end users who asked to remain anonymous. Although they personally did not go to the DMC themselves, they use hospitals that are similar to the DMC. One user said that she personally would like to see the emergency care unit improved. There have been a few times where both of her children have had an uncontrollable fever, and she says that they were poorly taken care of. Another end user said that she believes the staff could be more helpful. She argued that these hospitals need to improve their communication with other clinics around the area because she has not had any good experiences with the referral system. A physician who has had patients who went to the DMC said that the best way to combat the issue of long wait times is to hire more staff to pre-screen individuals who do not necessarily need to be seen by a physician. Here's our solutions. Our 7 criteria for a successful solution. It must be able to decrease revenue loss, improve the hospital's image within the community, improve morale to better patient satisfaction, be easily implemented, attractive to funders, and improve internal operations. Our solution could be financed by getting rid of unnecessary spending. Solution 1. This is a 3-pronged approach. The first leg includes internal incentive programs and patient-centered care training programs for staff members to improve patient care, staff attitude, and morale. The second leg is to implement external programs such as free clinics for the underserved and undocumented populations to strengthen the hospital's image and potentially decrease the emergency room usage. Finally, we can create a better communication system between patients, physicians, and staff members by using an online portal to book appointments or find patient laboratory results. Solution 2. We can increase the quality of outcome and host community-centered programs such as farmers markets and educational programs to improve the hospital's image and build trust within the communities. Solution 3. We can redirect money towards the emergency room services by improving operations and decreasing wait times. This can be completed through more efficient triaging. Here's our recommendations. We chose the first solution to be the best because it includes 3 major components: internal staff training, the implementation of a free clinic, and enhancing patient experience through increased patient-doctor communication. We believe that addressing all 3 of these areas together is the best way to increase the quality of care, which in turn will help bring in more donations, increase voter support, and patient intake. Our solution meets our criteria because improving the hospital and quality of care will help improve the hospital image, increase staff morale, through training and help reduce high emergency costs of uninsured patients by offering free clinic days. While implementing these programs may have an upfront cost, we will actually be able to save money in the long run. Our solution focuses mostly on addressing the needs and priorities of the end users by improving their experience. However, improving quality of care will benefit all stakeholders. Investors will benefit from seeing less excess spending and loss of funds. The staff will benefit by working in a more organized and well-trained environment. We have the following strengths and challenges that we still have to face. 1. Having a three-pronged approach is a strength because it addresses all of the major concerns with the hospital's internal staff employment and care delivery. Our challenges include the viability of opening new clinics to conduct free health services and the implementation of a communication system and the plausibility of training the entire staff to learn how to use it. Thirdly, with increased support for our programs, we would hope to receive funding not only to continue these programs, but also to implement new programs to maintain a positive public perception. Our potential donors include Kaiser Permanente or other universities. With increased community support, we may also be able to tax the community to support these programs at the hospital. However, it may place a financial burden on them. This concludes our case study presentation.